The vision of outstanding care, no exceptions, came from the staff. We asked them, what do you want to be known for? What do you want to achieve? And they came up with it. And they said, outstanding care, no exceptions.
When we're looking at developing our vision, mission, and values, we're really looking at what's important to our community, what's important to our patients, families, and our staff when we're delivering care.
When you come into hospital and you need care, you will interact with several healthcare providers that are all looking at your best interests. So if the team doesn't function well, then the patient care will suffer. And that's another reason why we ensure that everyone that works here is aligned in our goals and our vision and how we look after patients.
We have our partners at Erie Shores and Hotel du Grace and our community partners that will all be involved in re-envisioning what our healthcare system looks like in the future. And I think many people are aware of the work that we're doing on our new acute care hospital system, really redesigning healthcare for our region, something that's innovative, that's research-based, which really attracts the best of the best.
And that's how you grow a community. That's how you grow the medical care that you need. This is how you recruit talent. You train them locally. They learn to love the community and the hospital that they work in. They love the people and the patients, and they end up staying long-term.
Windsor Regional Hospital partners closely with the University of Windsor and St. Clair College, as well as other provincial, national, and international organizations to really ensure that we are implementing and participating in implementation of best practices and the latest technology to help our patients.
A couple of examples include our EVAR program. This is an endovascular procedure that's able to repair abdominal aortic aneurysms, where the procedure used to be an open procedure with a big surgery and a long recovery that usually takes weeks in hospital, and now can be done same day with the patient going home the following day. Another example is the Mako robot for orthopedic procedures, hip and knee replacements. And now we're able to do those types of procedures with high precision in terms of the surgical process and shorter recovery for patients as well. And then the other big example I could give is stroke management. We are able to go in with pieces of equipment into the artery itself, extract the clot, and save brain tissue and save lives. And that can only be done with technology, with human health resources, and with specialized care. And we're only hoping to do more as we get into the new facility.
I find in a time of a crisis or in a time of a difficult situation, that's when the team rallies around each other and rallies around our patients and our community to help support them.
The COVID pandemic was something that I think we thought was going to be over very quickly. And as our staff usually do in a crisis, we've really pulled together when it first happened, when we first went into lockdown, when we first saw it coming on the horizon. And we really planned for and implemented strategies that were going to allow us to continue to care for our community. We assisted in long-term care facilities and rest and retirement homes. We assisted with the temporary farm worker population. We assisted with our at-risk populations in Windsor-Essex. And so our staff were really able to pull together during a crisis to not only care for people within our walls, but those outside of our walls, and really helping to ensure people had access to testing, vaccination, screening, and care to prevent the need for hospitalization. We can't do this alone as a hospital, and all the work that we've done and our ability to continue on providing service, we've needed to have good relationships with our community providers, whether it's with Canadian Mental Health Association, with Windsor-Essex County Health Unit, EMS, Windsor Police Department, all partnering together to provide the full continuum of care for our patients in the community.
We are an acute care hospital, so therefore going out into the community is not part of our comfort zone traditionally. So we said to our team, what if we did this? What if we took a nurse and went out with Windsor Police Services out to the streets? If we could see them in advance and take care of them before it becomes an acute care admission. So they've been doing that with Windsor Police. It has reduced the admissions to the hospital for these individuals by some 40%. So that's a big win, that we can care for them where they're at and not force them to come to a fixed address for medical services.
I don't think any one individual could have won this award alone, and I don't think any one individual is going to be accepting of this award. This is a community award. It tells us that our team is functioning well. It tells us that our team is looking after patients to the best of our ability. And what it means for the community is that they have a place to go to when they need their medical care, and they should trust and know that they will receive the best care possible.
I really think that this recognition is really something that our staff deserve, and I'm really, really so proud to both be a staff member at Windsor Regional and to work with such an amazing team.
It's great to have the recognition of the whole team for all approximately 6,000 employees, professional staff, and volunteers. Gives that message of love to our staff to say, hey, you're it. You are very well supported by our community, and it shows that love and that support. And I know they send it back to our community as well on a daily basis.